2011, the World Health Organization had reviewed all of the evidence and decided that mobile phone radiation was a possible human carcinogen. How many people had heard that? Okay. It's interesting that that information isn't more widely known, and we can explore the reasons for that perhaps at a later time. But the fact is, the group that reviewed this evidence for the World Health Organization looked at all the evidence at the time in 2011. And at that time, they said it's important to conduct additional research and it's important to take pragmatic measures to reduce exposure. Now, that's why it's wonderful that Telstra is giving this advice, but we are not conducting additional research. And in fact, the World Health Organization itself is no longer conducting a leading study on brain cancer and mobile phones. Most epidemiologic studies find no increased risk of brain cancer from mobile phone radiation. They don't. Until 10 years of heavy use. And by the way they define a cell phone user in these studies, I'm not making this up, is somebody who makes one call a week for 6 months. Yes, yes. One call a week for 6 months. That was the definition in these studies, which, by the way, don't find any increase. Sponsored research, this is to put it politely, can induce publication bias. Another way to say this is that where you stand on an issue depends on where you sit and who's bought your chair. And there's a tremendous amount of sponsored research by people who are hired to do studies to find no effect. And that's plagued this field in a number of countries, including within the government itself. So I don't know about the details here with ARPANSA, but I can tell you in the United States today, the gentleman who is directing the Federal Communications Commission, Tom Wheeler, was for 10 years the executive director of the Cell Phone Telecommunications Industry Association. At least in the past, industry had a very clear strategy. And in my book, Disconnect, I document and quote in the new afterword that in 1994, when industry first became aware that there were studies suggesting that mobile phone radiation could damage brain cells of rats, a memo was written to, quote, war-game the science. War game the science. This issue is far too important to be gamed. It's not a matter of war. It's a matter of the future health of your children and grandchildren. Do you really want to have to prove that there's a significant increased risk of brain cancer before taking steps to reduce exposures to prevent that harm from happening? That's really the question. How much evidence do we need before taking precautionary steps? And that's what brings me back to my days at the National Academy of Sciences when we seriously looked at the evidence on passive smoke and airplane travel. We only finally took steps to act when it became clear that children of smokers were hospitalized more often. That was the evidence that we had to have. And I would suggest that at this point, we should be able to do better as a civilization. Here's what industry is doing. Vodafone has to provide a report to the American government as part of their annual reporting to the Security and Exchange Commission. They must report on what are called risk factors and uncertainties. And they report that they face risks because they may have to pay people for health damages. The last sentence there, a change to this view that there's no health problem could result in a major reduction in phone usage or major litigation. That's a risk. China Mobile, in their report to the U.S. Securities and Exchange Commission, they had to say, we cannot be certain that future studies will not impute a link between electromagnetic fields and adverse health effects, And because of that, it's a potential risk as well. AT&T says unfavorable litigation could result and require us to pay significant amounts of money. Well, speaking of money, would you give 2 cents? Would you pay 2 cents a month for every device you have, for every provider, for every manufacturer, in order to support the cross-disciplinary training program that is needed in bioelectromagnetics for engineers and physicians and computer scientists? That's what's needed to identify the data gaps, the research and development needs, to monitor the populations, to see what is happening to our children today, to look at hearing and memory and sperm count. That's what I think we need. We need a major program to fund independent research and training. The world is not dangerous because of those who do harm, but because of those who look at it without doing anything. So, thank you.